So that brings us to our next question, and it's really related to what we just talked about. Is it normal for breastfeeding to be painful?
Very good question. And it's something being pregnant and you're worried about with breastfeeding, if you're currently breastfeeding and enduring, or if you have experienced. In the early weeks, it's going to be the biggest complaint because as time goes on, the milk is flowing, it's going to get better. But in especially that first 4 weeks of life, the nipples, especially if you're a first-time mom, have never done this. In the first 3 days, baby is working for colostrum. It's a pretty strong suck. So
Yeah.
we're going to have for some sore nipples. Before the milk's in, baby's feeding very frequently as well, which can lead to sore nipples. So I like to preface that there is reasons why you would have soreness and all the things going on in the beginning. Okay. But in regard to a specific latching, what to expect is when you first latch baby. I like to use this as an example. This is the nipple you're latching baby on. When baby first latches, especially if they want to grab the end and suction on, that stretching of the nipple to the roof of the mouth, baby has to feel your nipple at the roof of their mouth between the hard and soft palate. You can feel it back there. Baby's got to get your nipple there. The technique of the big open wide and hug deep to bypass baby grabbing the end and suctioning on is going to help with that initial pain. If you have breastfed before, you know exactly what I'm talking about. When baby first latches on and that stretch of the nipple is like, oh, okay, breathe, breathe, baby, latch. Very important, stay very still. And then after that first suck series or two, you should notice relief, okay? I don't want moms just immediately yanking baby off in that initial pull because sometimes that's just the stretch and it's all new for the framework of the area. But give it just a minute, check baby's lips, make sure lips are nice and flanged, and then we should notice an improved comfort. If you're in the colostrum stage, even after, but massaging the breast for milk flow, before the milk is in, baby is working so hard and strong for the colostrum that's thicker. They're working for it to get enough. Yet it can be painful on those nipples with that high pressure. Okay. When the milk is flowing, you're going to notice, and your milk comes in, you're going to notice improved comfort because baby has flow. So it totally changes from that fast pressure, fast and hard, to more of a long, and if you're pumping, you know, that expression mode, it changes to the slower cycle rate per minute. And in the beginning days, we're stimulating the stimulation mode. So thoughts on that is we may have an initial pain, check lips, and it should not hurt beyond that too much unless we've got a break in the skin or something else going on. But in general, we're looking for decrease significant from that initial latch and none at all, hopefully. If you do feel pain, we talked about breast massage, check baby's lips, and if all else fails, we're going to delatch and we're going to try again, baby.
Try again.
Try again. And then throughout the feeding, if you're feeling discomfort, one thing that I recommend is changing up baby's mouth angle. If you just prefer this front hold and you're always having baby at that same mouth angle, up and down, your nipple may start to get a compression because baby's working in that same angle. So changing up the hold then changes up the mouth angle. So that's one recommendation I have is if you are getting pretty sore, to change up baby's positioning to help that continuous wear in that line. Oral anatomy is something that many moms know about, but just checking with your pediatrician if you have concern for baby having any tight oral that's affecting baby, just causing a lot of pain. I definitely want to mention that. Always check with your pediatrician or have a lactation consultant check baby's latch in that regard. So definitely we want you to troubleshoot positioning, what to expect with latching, but also know there's resources for continued help.
That's awesome.